Turning 65 soon? Trying to figure out if a Medicare supplement plan is right for you? You're not alone. In the next few minutes, I'll explain it simply so you can make a confident decision. I'm going to break it down in a clear and easy way. If you find this video helpful, please take a moment to like, share, and subscribe so we can reach and help more people just like you. A Medicare supplement plan, also called Medigap, helps cover some of the costs original Medicare doesn't fully pay. It works as secondary insurance alongside your original Medicare coverage. One of the most important times to enroll is during your 6-month Medigap Open Enrollment period. This starts when you are age 65 or older and enrolled in Medicare Part B. During this window, insurance companies generally cannot deny you coverage because of pre-existing health conditions. That can be a big advantage. If you wait until later, you may have fewer choices, pay more, or be denied coverage, depending on your situation and state rules. And here's something many people don't realize. This is usually a one-time enrollment opportunity. It does not happen every year, like the annual Medicare Open Enrollment period. Timing matters. Original Medicare has two main parts. Part A helps cover hospital care, and Part B helps cover medical services like doctor visits, outpatient care, and preventive services. But Medicare does not cover everything. There are out-of-pocket costs like deductibles, co-payments, and co-insurance. That's where a Medicare supplement plan comes in. What it does: a Medicare supplement plan helps pay for many of the costs that original Medicare does not fully cover. Depending on the plan you choose, it can cover things like hospital costs, doctor visit co-insurance, and other out-of-pocket expenses. This can give you more predictable healthcare costs and peace of mind. How it works: with a Medicare supplement plan, you can typically see any doctor or specialist in the United States who accepts Medicare. You usually do not need referrals to see specialists. This gives you a lot of flexibility compared to some other types of plans. Important things to know: Medicare supplement plans do not include prescription drug coverage. If you choose a supplement plan, you will need to enroll in a separate Part D prescription drug plan. Helps pay for the brand name and generic drugs you need. It's optional and offered to everyone with Medicare by insurance companies and other private companies approved by Medicare. Even if you don't take prescription drugs now, consider getting Medicare drug coverage to avoid paying a late enrollment penalty if you join a plan later. Also, these plans usually have a monthly premium in addition to your Medicare Part B premium. Who it might be good for: a Medicare supplement plan may be a good option if you want predictable out-of-pocket costs, freedom to choose your doctors nationwide, less worry about unexpected medical bills. Who it might not be for: it may not be the best fit if you are looking for lower monthly premiums or extra benefits like dental, vision, or hearing, which are often included in Medicare Advantage plans. Don't forget, the best time to enroll in a Medicare supplement plan is during your Medigap Open Enrollment period. This is when you first turn 65 and are enrolled in Medicare Part B. Medicare can feel overwhelming, but understanding your options is the first step to making a confident decision. If you found this video helpful, please like, share, and subscribe so we can reach and help more people who may be feeling just as confused. This video is for educational purposes only and is not a complete description of benefits. This content is not affiliated with or endorsed by the federal Medicare program. Benefits, premiums, and plan availability may vary by location and provider. For official Medicare information, visit Medicare.gov, call 1-800-MEDICARE, 1-800-633-4227, or contact your local State Health Insurance Assistance Program, SHIP.